let's take a look at our arteries and veins. These two graphics illustrate the variety of different arteries and veins that are throughout our body. As you can tell, there's a lot for each part of the circulatory system. The key difference with arteries compared to veins is that they contain a layer of smooth muscle. And this smooth muscle allows for a certain level of adaptability of the cardiovascular system. And the best example is when a patient is going into shock. We will talk about the various different forms of shock at a later time, but it's a very good example because what our arteries do, especially in the arms and the legs, they use this layer of smooth muscle to clamp off the blood flow to these regions and allow that blood flow to go towards the heart, lungs, and brain, maximizing blood flow to those regions. Because in shock, we are concerned that the nervous, pulmonary, and heart will not get adequate amounts of blood, and then you end up with a significant amount of irreversible tissue death, and you run the risk of dying because of this. So our body has a mechanism to try and prevent that by maximizing that blood flow to the core of the body. And if you liked the highway and highway exit example, you can look at it as if there's an accident at a certain exit of the freeway that prevents people from getting off there. So when we're going into shock and our blood is being shunted from our arms and our legs back towards our core here, the freeway exits become closed. So there's only really one way to go, and it's back towards the center of the body. Our venous system, on the other hand, it's a lot more elastic. And it only really serves as a storage vessel to help bring deoxygenated blood from our systemic circulation back towards our heart to go into the pulmonary circulation. Something interesting with our venous system, it holds approximately 60% of our blood volume that is moving through our body at any given moment in time. And that's just a fun fact. That's just the nature of the beast here on how our cardiovascular system maintains its blood volume. When you guys learned to palpate pulses in the neck or in the radius here, so your carotid and your radial pulses, then you have your arteries in your foot that you can try and learn to palpate. These are a little bit more difficult. You're palpating arteries, and we'll talk about blood pressures and pulses in a little bit, but you can't palpate a pulse in a vein. the pressure inside of this vessel is not high enough that when we actually touch a vein, we can actually collapse it. So if you actually look at your forearm and you kind of squeeze your hand a few times, you can see the veins in your forearm start to pop out a little bit. And you can kind of push down on it and feel how spongy they are. And that's pretty much it. This is what makes it ideal for starting IV lines, because there's not a lot of pressure to overcome in there. So we're not going to accidentally cause the patient to hemorrhage if we don't get the IV correct the first time. It's going to be more of a slow oozing bleed. If we lacerated or punctured an artery, on the other hand, this is when we start to see like squirting blood. And that is another important thing to differentiate. If you see slow oozing blood from an injury, it's likely veins that were damaged. Where we see spurting blood coming out of an injury, it's likely an artery that has been severed. And again, these are things that we'll discuss more in trauma, but just to start familiarizing yourself with that overall concept. Now, as our blood flows through arteries to our body's tissues, it turns into progressively smaller vessels. So we have the main artery. They break off to arterioles, and then they break into the capillaries, which is our smallest vessels. So you're taking the exit off the freeway, then maybe you're going to get onto your surface streets here. You can look at the arterioles as surface streets. Then when you get into the capillaries, you are in the neighborhood. So you're on residential roads. And this is where gas exchange occurs. So we have these organ or tissues of some kind, just random cells. You don't have to be specific. They need oxygen. The arteries have brought freshly oxygenated blood to the tissue in the capillaries here. And they offload that oxygen. And the organ tissues are like, hey, we have these CO2 molecules. Would you mind taking those off of our hands? And the blood in the capillaries, like, sure. Load them up and we'll give you the fresh oxygen. So you exchange the gas. Remember, this is referred to as internal respiration. So we are exchanging the gases. There's also nutrients involved, like glucose, bringing glucose to the tissues, and various other waste products. But generally speaking, focus on the gas exchange between the oxygen and carbon dioxide. Then we leave the residential streets and we get back onto the general surface streets. These can be looked at as venules. Then the venules lead to the on-ramps to the freeway. You can look at it as veins. Then it goes into the great vessels, the highway. So the superior and inferior vena cava. So it's just progressively large to slightly smaller to the tiniest that we have. Now the capillaries are unique in that our red blood cells, the oxygen carrying cells of our body, line up one by one in the capillaries. This maximizes their ability to exchange those gases. Now, this image right here, this one's really good because it demonstrates not only the vessel diameter, so it has aorta, larger arteries, smaller arteries. Then we get into the arterioles, capillaries, the smallest vessels, venules, small veins, then our larger veins, such as our superior and inferior vena cava. So you can kind of see that progression. Remember, we have arteries going to our lungs, so pulmonary arteries. We have pulmonary veins that are returning oxygenated blood back to the heart. Then we have our aorta that is sending out to the systemic circulation, going through this progression, then back into the superior and inferior vena cava. Now, this graphic also demonstrates what point I made earlier, in that when we palpate pulses, we are palpating the arteries. And that's because the pressure within the arteries are much greater than compared to the veins. So you can just follow this blue line, for example, which represents our systolic blood pressure, which I will talk about in a moment. It's high, then it progressively gets lower. And this is why our veins are so easy to collapse. They don't have the necessary pressure in order to stay up and for us to palpate that pulse. Then one of the last major organs of our circulatory system that often goes unlooked is our spleen. This is a solid organ located underneath the rib cage, and the purpose of this is it's a filter. So it filters toxins, waste products out of our blood. It also serves to help protect us, so it has immune functions. It also acts as a storage vessel for red blood cells that we don't necessarily need in the moment. It's located on the left side next to the stomach, and it's particularly susceptible to injury. And if you've heard of somebody who might have had a ruptured spleen, they probably had to get rushed into emergency surgery, because there is a significant amount of blood that is flowing through this particular organ. And when it becomes lacerated, that results in a lot of bleeding into the abdomen. Depending on the severity, they might try and repair the spleen, or in some instances, they will actually remove the spleen. You can live without it. It's perfectly fine. There's other mechanisms that our body has to filter and clean out our blood.